Welcome to the Heart of It All. I'm Teri Hart. All month, we've been talking about Alzheimer's and dementia for Alzheimer's Awareness Month. And today, we are focusing on the unique experience of the caregivers to those living with dementia. We are so very lucky to have Dr. Adriana Shnall, Program Director, Baycrest Koschitzky Centre for Innovations in Caregiving, for such an important conversation. Hi there. Thank you for being here. This episode of The Heart of It All is brought to you by Capital Direct. If you and your family are facing an Alzheimer's diagnosis, your time should be focused on the care for your loved ones. Capital Direct offers flexible home equity solutions, including their trademarked Flexi Line, to support your new normal in times of need. All you need to know is at capitaldirect.ca. All this month, we have learned so much about Alzheimer's and dementia with leaders in the field. From Kathy Barrick from the Alzheimer's Society of Ontario, Dr. Amina Jabbar, and filmmaker Heidi Levitt, there's no doubt that caring for a person living with dementia has unique and deep challenges. This is a disease that is often called a family disease because of its deep and wide impact. Today, we are so grateful to have a leading authority in the field of caregiving, Dr. Adriana Shnall, PhD, MSW, and RSW. Dr. Shnall serves as the Program Director of the Koschitzky Centre for Innovations in Family Caregiving at Baycrest in Toronto. With over 30 years of clinical experience, Dr. Shnall has made significant contributions to the field of geriatric care, working with older adults and their families across various settings, including outpatient community services, long-term care, and inpatient services. Dr. Adriana Shnall, welcome so much to the Heart of It All. We are so thrilled to have you here.
Thank you so much for having me. I am really excited to be here because this is what I do for a living. And personally, I live the experience of being a caregiver as well, but it's been my life work as well. So thank you.
It's so fascinating to talk to you, a person who has dedicated their life to caregiving. What is it that you find so fascinating about this population?
Fascinating is not the word I would use. Fascinating is something super interesting that is not happening to you. When it's happening to you, it's painful. And so I don't like to think of it as fascinating. I mean, as a researcher, it's fascinating. But I'm sure those families that are living with somebody they look after with dementia, they would be upset if I use the word fascinating, because for them, this is their lives and it's painful. And even though there's moments of happiness, overall, it's not an experience that anybody would choose for themselves.
Before talking to you, I Googled and watched and listened to other things that you've done. And you are so diligent about the language that you use in this space. For everybody listening, Dr. Shnall did say I could refer to her as her name, Adriana. So, Adriana, can you tell me about why language in this sector is so important?
So I think language overall is really important because as humans, this is one way we communicate. The interesting thing is I don't think there's a right or wrong way of calling things, but we have to use language that's congruent with our belief systems. When I think of things, I think of it, am I expressing myself correctly? Is this how I view things? And so in the world of caregiving, a lot of people don't like the terminology caregiving because it feels like it's unidirectional. I give care to you. And we all know that relationships go both ways. So maybe I'm giving care to you, but you make me feel like a good friend because I'm able to support you. Some people would choose the terminology care partners because we're partnering in this. I'm not convinced we're partnering. And to me, somehow I think of partnering as having some sort of choice. And sometimes we don't have choice. The other really important piece is I was told, Adriana, just stick to the word caregiving because people then know what you're talking about. When you start to introducing language like care partner or carer, people lose you. And so just for the sake of communicating, I choose the term caregiver. and even family caregiver, even that includes chosen family.
I want to talk about the Koschitzky Centre at Baycrest and what the Koschitzky Centre at Baycrest is doing, Adriana, because it is revolutionary and it is world renowned.
It's been an evolution, and it's been a project that's started really out of a dream I had and some colleagues had around. We're missing the mark when we don't fully understand that families are part of the equation when we're treating patients with dementia. Because the person living with dementia does not necessarily view the world or the reality the same way as the family, where the family is really affected. Most people with dementia realize they have difficulties, but don't realize the extent of their problems. We're so busy treating the patient, and in dementia, there's still no treatment. We can address some symptoms, but we're not curing dementia yet. And so it was this idea is we need to focus on families and make them our priority. Because even when people come to a memory clinic, it's not the patient coming for treatment generally. It's the families that notice there's a problem and bring them. And if we don't have the families on board, we have nothing. One thing that we learn and that we do is we try to tailor the interventions to each unique situation. And Teri, like you said, there's such a diversity of experiences. If in Canada we have 8 million caregivers, we have 8 million different experiences, really. And based on age, gender, stage in life, it's different if you become a caregiver in your 40s, in your 20s, or in your 80s. Difference whether it's your parent, your partner, your sibling. And so we want to tailor whatever it is that we do to that particular person.
We talk about all kinds of caregiving here on this podcast, but this month we have been focusing on Alzheimer's and dementia. What makes caring for someone living with Alzheimer's or another form of dementia uniquely challenging?
There's several things, but I'll start with, to me, the most difficult is that you're losing the person as you once knew them. And dementia is like saying you have a headache. It doesn't say the cause of your headache. You could have a headache because you have tension headache and stress, because you have a tumor, because you have an infection, because you have a fever. Alzheimer's disease is the most common cause of dementia. But what's different is that there's also not just memory problems, but there's personality changes. And so you're losing the person really as you see them because the relationship changes. And so in the literature, it's called ambivalent loss, where the person is physically there, but they're not the parent you knew, the partner you knew, right? And so that is really difficult to deal with because it's not like cancer and not of the brain, where there's medical changes, there's grief, there's all kinds of emotions, and you may have to do a lot of medical related activities as a family member, but you can have a relationship with a person. Like the person is who they were. It's different because now there's grief, there's fear, there's all kinds of things added to the equation. With dementia, it's like being with somebody that doesn't have insight. So you can't relate in the same way. If it's your partner, you can't communicate in the way you're used to communicating. You have to take over a lot of the chores, things that if you're looking at couples, people split. You know, you manage this, I manage that. If it's your parents, before they were independent, and now you have to take over all kinds of transportation, making medical appointments, whatever that may be. So there's the personality change and how the relationship changes. The other piece is most dementias can last up to and over 20 years. And we also know that the longer you're a family caregiver, the more stressful it is. So it's not short-lived. Here you could be dealing with very slow, steady, progressive changes over years and years and years. So that makes it more difficult. Depending in the stage of life you're in. So younger onset dementia, so where symptoms start before the age of 65. You could be the partner to somebody who, I mean, you're still working, they're still working. Financially, you're not prepared for this at all. So with dementia, also, it depends on the cause of the dementia. So it's the frontal temporal dementias where our frontal lobes are affected is more difficult because people lose empathy, right? And so this change in personality is so painful because even when you know what you're dealing with, you just can't get over that this person can be so
Different.
different and mean, nasty.
Does it ever go the other way? Can people become kinder and gentler? And
Yeah. So there's no one way to go. It's not just because you were always this way, you're a nasty person. Some people have the best lives, the people living with dementia, because they now don't have to worry about anything. They've lost their inhibitions, so they feel free. They're kind and nice and loving. So there's no predictability to these patterns. And people seem to think, well, he was always nasty, so he's going to be worse. Not necessarily.
Alzheimer is a progressive neurodegenerative disease. Emphasis on progressive. I think that is so crucial for people to understand. Assuming you agree with that important piece of information, how do you prepare those families that walk through your door as they're embarking on this, do we have a problem or don't we question? How do you prepare them for what and how the disease will progress?
So I'm of two minds. And depending when in my career you would have asked me this question, I would have answered differently. I mean, I've had clients come back to me years later and say, when you said that to me about, my husband was going to get lost, I was furious with you for telling me that. I didn't think it would happen to him. And so there's a lot of science and art in knowing how to share information with people. Because you say certain things too early when people are not prepared and emotionally they're not there. Because everybody can read the internet and there's good information on the internet. The problem is it's a grieving process. When you get a diagnosis like this for a family member. And the other thing is nobody can tell you how quickly things will happen. And there's other things that also happens. It's very common for people to try to, we call it exit seeking. They're looking to leave, like when they wander off.
So exit seeking. So oftentimes we will hear about people who are experiencing a form of dementia that they will get lost or they will wander off. And the medical term for that, or the term in the language, is exit seeking.
So exit seeking is not just getting lost, but it's like people in the middle of the night, they get up and leave, right? And we used to call people wandering, like they're aimlessly going somewhere. The reality is nobody's wandering. In their minds, they had an idea. So a common thing is, oh, look, it's dark. The kids are not home because their reality sometimes is they're living in the past. It depends. And so somebody has this idea, the kids are not home. It's getting dark. I better go look for them. People are not wandering. They have an idea in their minds of why they went out, why they exited. Right?
How important is it, Adriana, to recognize that somebody living with dementia's mind is still working? They have ideas. They're not aimless.
It's really important because we call it responsive behaviors. There's a response. We used to call it neuropsychiatric, psychological symptoms of dementia, give them, fancy names. But at the end of the day, people are acting because, if they're in pain, somebody who's yelling or is agitated, it could be that they're in pain and they can't tell us because they can't figure that out, but they just feel something's off. And so they're yelling, right? And so it's really important to understand that behavior has meaning. We may not understand the meaning.
And they might not be able to communicate.
If they could communicate, they probably wouldn't have dementia, right? But could you imagine how frustrating not being able, You get into a fight with your mother. Your mother is living with dementia. She still has this feeling of like upset, but now can't remember why she's upset. For her, she may totally forgot Teri came here and did this and said this to me, but still feel like, we feel it in our bodies. We're stressed and we don't know where that's coming from.
Or there's a moment when that synapse fires and then it goes away. And I mean, I don't know neurologically what is happening, but that's what I imagine it to be like. One of the things that I hear from people, and I think everyone listening, whether they have an active person in their life living with dementia or not, they've certainly had some relationship with somebody this is their lived experience. And one of the things I hear frequently from dear, dear friends and some family members is, and you've used the word, the grief of losing someone over and over again while the person is still there. Like that emotional challenge. Can you walk me through some of the conversations that you might have with a family member, with a caregiver who is experiencing that grief?
So I think it's important to understand it's a process and it kind of ebbs and flows because it's helping people understand that it's not just about learning skills on how to look after the person that you're looking after. The first thing you need to learn to is deal with how you're feeling and your emotion about it. That is crucial to help families be in touch with their emotions and also recognize they're normal and they're okay. So the grief, it just comes in waves. So you're looking after helping your dad and knows that you are somebody familiar to him, but doesn't remember your name, Teri. And he's friendly with you. He feels safe with you and you're doing your thing. And then all of a sudden he says, Teri, you look lovely. I love you. That is amazing and devastating all at once. It's amazing because it's like, oh my God, he's back. And it's devastating because the next minute is, where did my daughter go? And that something that feels like nothing is like, I had hope for about a minute that he was back to being my dad. And the next sentence, I lost him all over again. And it's this, things are always kind of bad, 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 and you never get any positive signs. You kind of get used to this is what it is. It's hard, but you can deal with it. But it's more nuanced than that. And that is what's so hard for families. What I help families people help themselves, but is live more in the moment. For the moment that he said, hi, Teri, you look lovely, or I love you, cherish that.
There are so many feelings associated with this disease, really complicated feelings, frustration, anger, resentment. And those are often viewed in society as negative emotions. And I think people can feel really guilty about having those very real emotions when they're caring for somebody who is living with Alzheimer's. But why is it important to recognize these feelings as caregivers?
First of all, to give ourselves some grace as caregivers. We're humans. It's a very human experience being a caregiver. And given our population and the rates of dementia, we're all going to experience it somehow, unless we live in our own cocoon. If we have relationships, it's going to happen. And it's important for us to know we have complex emotions as humans, and nothing is negative or positive. Like I don't like it when we talk about positive emotions and negative emotions as if happiness is a positive thing and anger is a bad thing. It's not as comfortable when we feel anger, but sometimes anger is what helps us move forward with things and make good, important decisions. So is that a negative emotion? I'm not sure. It doesn't feel comfortable, but it's a lot of these negative, difficult, whatever we want to call emotions that at the end of the day have can have such positive impact for us. And if we can only listen and use those emotions and not judge them, just they are part of the range of things human experience.
Is that the suggestion and recommendation from you to caregivers when they're experiencing frustration and anger?
Absolutely. But what's really helpful is listen to it and learn to sit with it. You don't have to escape it. We don't have to, just because we feel this anxiety that doesn't feel good, it doesn't mean we need to leave it.
Repetition for somebody living with dementia and Alzheimer's can be so very challenging for caregivers. It is an ongoing battle, an ongoing tactic to try to get somebody living with this onto something different. What strategies, if any, do you suggest to people who are dealing with that stage of the disease that it is about repetition?
So 2 things. The first thing is manage your emotions, because most people know what to do. You just get so frustrated. And first of all, accept that sometimes we're going to lose it. You're going to lose it and say, I already told you that 10 times. Leave me alone. And feeling guilty after the fact doesn't help. So what I think is the first thing is think, oh my God, I could kill him. And be okay with saying these things. Like, oh my God, I cannot believe this. Frigging illness, And putting it onto the illness as opposed to the person sometimes helps. Because if you live with somebody with cancer that said, oh my God, the pain is intolerable, you wouldn't say, oh my God, you already told me 20 times in the last hour your pain is intolerable. You'd never say that. And so in many ways, this is kind of putting it to the illness. Part of the problem with this illness is that you don't remember, and that you don't remember that you don't remember. And so parties like thinking to ourselves, oh God, I just can't take this. And accepting that emotion, because if we are okay, if we don't get all bent out of shape, the person's okay. And then there's techniques that are very teachable, like walk to a different room. Sometimes for whatever reason, you're in the kitchen, they ask you for the 10th time, where's the ice cream? You're just like, I told you it's in the freezer. Here's the ice cream, whatever. And then distraction works. And you say, come with me to the living room. I want to show you a picture of Tommy or whatever, some grandchild. Totally changing distraction, not just the topic of conversation, but physical location.
That is so actionable. That is a great actionable recommendation.
And give yourself grace if you can't. Even though you know what you should be doing, we can't all do it all the time. And that's just fine. That's the way it is.
I think most people have heard the recommendation, do not correct people. Is that still the biggest message of, caregiving, being around somebody who has some kind of dementia? Do not correct them?
It is. And so I want you to think of it this way. The reason why you don't correct people is because they forget that they forget, and they have an illness that is a memory problem. So correcting people, even if you correct them, they're not going to remember 2 minutes later. And in the meantime, you make them feel bad about themselves. For the minute that they realize that you corrected them, they feel bad. The problem with it is you're not changing anything, right? At the end of the day, the person's still going to think whatever. And they feel bad. You feel bad that you made them feel bad. They're not going to remember now because you corrected them. I think the reason people correct is out of sadness and anger.
I think that there is an embarrassment factor.
It's a hard feeling to acknowledge, right? But this is not serving any purpose. By me correcting them is not helping anything. And it's not making that person or me feel any less ashamed or embarrassed. It doesn't fix that problem. So owning the feeling, it's coming out of a place of embarrassment or shame. Become aware of that. And then it's like, it's not going to help me to start correcting them. people, it's like, you're wrong, you're wrong. Partly is out of trying to get the person back. It's like, I can't believe you don't know. It's kind of fighting for the person. Like, of course you know this. Just give it a try.
You touched on earlier that this disease can result in significant personality changes. That is so difficult for people. What does one do there? Is this just a new version? It's up to you to like manage that?
Well, it's not up to us to manage anybody. That's the one thing we need to remember, that we help people through certain experience, but we can't control people in a way. I tell my children, for example, when I have dementia and I'm in a nursing home, make sure you pluck my hairs, that I still look presentable, that my hair is nicely done. These are important things to me. My kids will tell you that, and that I want hot coffee and Haagen-Dazs coffee ice cream. So we all have our things. I figure I told my children, this is what I like. This is Adriana now, pre-dementia. And if I get dementia, will those things be important? And will that be who I am then? If somebody comes and plucks my hairs from my chin, I may just whack them and be totally furious because I may not care, or I may not want coffee or ice cream anymore. We evolve. Like, just if we think of ourselves at 15, at 24, at 50, at 60, we are the same, but we're not the same people. We have different lived experience.
So walk me through, if Adriana now says, Haagen-Dazs ice cream, make me look presentable, but if Adriana does end up in a situation where you're living with dementia and then all of a sudden doesn't care about her hair being brushed, how do you then listen to this new version of Adriana, or do you remind Adriana that, no, you cared about this? What's the right thing there?
And so again, this is what's so difficult about dementia, that there's no right or wrong. It's learning to live in the grays with, it's not either or, it's and but. So I may still be the same person, but right now don't bother me because I think you're being a nuisance to me. I mean, that's what's very freeing about dementia for the person, I think, is that it's just the moment. Right now, this is what I feel like doing or not doing. And this is so hard for all of us because we're not used to living in the moment in the same way.
I'm learning so much from you about these emotional responses that we have. It is about paying so much attention to what information the person is giving you at that moment. They are communicating with you. It just might be very different than how they used to communicate.
So this is the thing. And it's, again, who has the problem? The family. And it's not whether they're a different version or not. It's, again, we don't have to worry about, are they different versions, are they the same versions, or whatever. This person now is living in the moment and is enjoying this.
Let it be.
Why do we have to make sure that everybody's in their box of this is how you should be behaving?
Well, listen, I'm the worst at that. I am like, I have a real hard time with that. I think that, and I'm going to suggest that most people are like me. And there's something safe about that, right, Adriana? There's so much around this disease that is unsafe or we feel could be unsafe.
Imagine you have somebody disinhibited that does as they wish, feels for the moment. Our whole society is predicated on we follow rules. Otherwise, things would fall apart. These are the rules. This is what you do. This is how you behave. There's a right and there's a wrong. And now all of a sudden, you have somebody who has no right or wrong, no idea this is right or wrong, goes by feeling alone. Imagine if we all went through life doing whatever we wanted. Society would collapse. And here we have the people living with dementia that now are freer. I think we're all true versions of ourselves through various stages in our lives, no different than when we're adolescents. We did things that we would never do now.
Oh, your perspective on this is so fascinating. It really does shift it. You know, I don't think we can shift ourselves 180 degrees, and I don't think most of us need to shift 180 degrees. But those 3 or 4 degrees that create more empathy and allow us to think more about what this person is experiencing, I think is the goal, right? Like that is the goal, to have more empathy in these relationships.
100%, because I think those families that can empathize with what the person's going through have an easier go at it. But I want you to also remember it's an empathy for the other person living with dementia, but empathy for themselves too. That when they're losing it, when they're angry, when they're having these feelings, give themselves that empathy, that grace.
We have learned that early detection of this disease can make a big difference in terms of treatment, in terms of the progress of the disease. What are some things early on that maybe we're putting in a different classification and we should be looking at as potentially a dementia?
So there are many and they're subtle and they happen on and off. One of them is financial mismanagement, is one of these things that people before were fine and all of a sudden they're not paying their bills on time, they're not filing taxes. They had a business that was doing well and now it's not doing well, and excuses for things. So, and that's very subtle unless you're involved with the person and looking at their banking. The other one is like you make plans with somebody and then they forget. And a lot of the times we kind of like, yeah, everybody's busy. But when things become a pattern, it's when we start thinking. And it takes years for most people. It's interesting because something like Alzheimer's is changing our brain for like up to 20 years before we have symptoms. And so there's very subtle things that happen to people. And we all make excuses, right? Oh, you're stressed, or we're all getting older. It's understanding what's normal aging versus you told me that story 3 times in a period of an hour. That's not normal aging. Normal aging is I bump into you again in a month and I tell you the same story I did. That's kind of normal aging. But if during the same interaction I tell you the same story twice, that's a problem. People that were immaculate dressers or put themselves together really nicely and now they're not. They have stains on their clothes and that's out of character. People that perhaps more disinhibited than they were before, they're making jokes that are kind of inappropriate that they would have never made before. It's just kind of, that's weird. Mom would have never said something like that before. That's offensive. So those are the kinds of things that generally we start looking for patterns. And I think the thing to remember is a pattern as opposed to something happened once.
I don't like to use the word mistakes, and just in this conversation with you, I think that you would agree with that. And your empathy shines through everything you're saying, and I think mistakes is a challenging word. And I think most people truly are in this life doing the best that they can. I operate with that belief to my core. Um, but what could people do to modify or improve the outcome of the dynamic or relationship with somebody who is living with dementia?
So one thing is educate yourself. There's a lot of material out there through the website, through the Alzheimer's Societies, Baycrest on communication. There's ways to communicate with people that make a difference. One of them is don't give somebody long, complicated questions like, oh, hi, how are you? It's snowing outside right now. Do you think you want to go out? And maybe afterwards we can go for dinner. All the person with dementia remembers dinner, the last word they heard. So speak short, concrete sentences. You don't have to yell. They're not necessarily deaf or hard of hearing. They just are forgetting. It's a lot of information. So in terms of communication, make it brief, short, and to the point. Give people choice is another technique. So if it's snowing outside and we have to go and you're getting agitated, we have a doctor's appointment and my mother's not putting on her jacket, and oh my God, and you start escalating. And so you say, Mom, here's your red jacket and your blue jacket. Which one do you want to put on? So some ways of communicating are making it short, concrete, give people choice so that they don't feel like you're controlling them. Nobody likes to feel controlled. Try to manage when we're anxious. It reflects on the way we say things, no matter what, how we say it matters. And when you're losing it, just walk out. Just give your count to 10. Just go to the next room and just say, okay, I just can't take this right now. We'll start again in a few minutes because I'm about to lose it. So communication is also more than just verbal, right? How our body, if we're talking to somebody with dementia, they're sitting down and we're standing up on top of them. That's kind of scary and controlling. Sit down at the eye level of the person. Make eye contact, look at them in a calm tone. Say, Mom, we need to go to the doctors. I know you don't want to put a jacket, blue or red, and show it to her. So a lot of communication, we can have a whole podcast and then some on communication. But I think to remember short, concrete sentences, manage your tone, manage your emotions. And if not, just come back, count to 10, go to a different room, come back and start again.
So we know how taxing it is to be a caregiver for somebody living with Alzheimer's or dementia. I'm going to throw a couple things at you here. What should we look for if we are that secondary person in terms of burnout, in terms of a level of frustration? What should we be aware of that maybe the primary caregiver can't see for themselves? And when is it time for the caregiver to look for more support?
Let me first start by saying families of people living with dementia, caregivers, are 6 times more likely of developing dementia themselves. So think of that number, 6 times more likely. And it's not because it's contagious. That's not why. It's because of the stress associated with it and the poorer lifestyle associated with it. So I find when you give that to any caregiver, it's very sobering.
Well, it's terrifying.
Well, yeah. Yeah, that's a better word, actually.
Terrifying. 6 times more likely because of the stress. A family member or a direct caregiver who is the person 6 times more likely?
The family caregiver. And so it's not one cause. It's because dementia risk factors, 45% of them are lifestyle. Things like exercise and diet and stress management, pollution, socioeconomic status, cognitive engagement, social engagement, all of these things. We know that family caregivers are really high risk of being socially isolated. And so social isolation is a huge risk factor for dementia. Family caregivers of people with dementia over time become socially isolated. So it's multifactorial. But if you're seeing that somebody is not looking after themselves, it's not enough to say, do self-care. I mean, there's nothing more infuriating than telling somebody, well, self-care, like going for a manicure is going to be the answer to all the problems. And who has time and who am I going to live my person with while I go for my manicure? And so I always think of it as for caregivers, if they can find what's their thing in life that moves them. And it could be for all of us is very different things. So I'm an ultra runner. I run in the forest, in mountains. This is my passion. I will do anything to follow my dream of climbing mountains and running in forests. Like this is my thing. Whatever that may be for you, is finding what that thing is and making time for it. Because it's basically making time for who you are as a person. And so as a caregiver, as long as I have that, I feel I'm okay.
You're still existing as a person outside of all of your other responsibilities and things.
That's what it is you without your rules, without relationships, without all these extra things. What makes you you that just fuels your spirit?
I think that one of the most challenging aspects is when the person living with dementia can no longer live on their own,
Mhm.
when they need more medical supervision or they need just different physical residence. Is there a specific thing that people can know when the time for that is? And how do you advise people in making that really difficult decision?
So this is a whole other podcast. You ask me these great questions that are so complex. So in Ontario, I'm just going to speak about Ontario. The government manages admissions to long-term care. And the waiting list for some places are up to 10 years to get somebody into a facility of your choice. And if, God forbid, you fall and break your hip, you end up in a hospital, then they send you can't go back home. They send you wherever. So people don't necessarily have control over it the same way. And so if you can't apply too early because the government, the Ontario Health at Home teams, you're not eligible to apply if you're too early in the illness.
Right.
And so if you have money, you can look into retirement homes.
That have graduated care.
They are very expensive. They start at $5,000 a month. And there's less choice in that you need to pay for private care on top of that for hours.
I'm just going to interrupt for 1 second and let people know that we do have an episode coming up on exactly that. Where are we going to live with Pat Irwin? I don't know if you're familiar with Pat Irwin, but she is spectacular and has worked in this sector for, 30 years. And we walk through what those options look like. So that's coming up on the pod.
That's super helpful. So our system is complicated. You can't say, well, my mother's ready for placement next month because you were not going to find a facility, and you do it to her and they call you out of nowhere and you have to make a decision within a few days. So the thing is, when people start having more and more crisis and you kind of know it's just becoming too difficult. You're working, you have a life, and then you keep getting these calls. And all of a sudden she was living by herself and this is no longer possible. She had a flood in the apartment and then left the stove on, right? So these mini crises, there are not so many, are becoming more and more frequent. And so people know. The problem is there's a difference between knowing when it's the right time and with the constraints of our system, implementing that, making it work.
Yeah.
And that's what's so hard with our system. So sometimes you have to do it earlier because when you need it, it won't be there, but you do it too early and you won't be allowed to apply.
Where do you still find the meaning in the connection? Where do you still find the meaning in caregiving when those calls become more frequent, when those personality changes are so challenging, when the repetition is driving you mad, when all of the things we've talked about are all present simultaneously? Where do you find the goodness and the meaning in it?
This is where we have to do a lot of work on ourselves because it's this idea of making lemonade out of lemons. I mean, nobody chooses to become a family caregiver of somebody with dementia. But we grow a lot out of it. We learn a lot about ourselves. There's moments of connections. There's things that are funny that happen. Just somebody I know was telling the neighbor, I was just diagnosed with Alzheimer's disease. And so I said, what prompted you to tell the neighbor? He says, well, if they see me running up and down the street naked, at least they know I have Alzheimer's. Like, so
I'm going to share a funny story as well. A friend whose brother was visiting their mother, and very well-read family, and the brother was talking about Shakespeare, and the mother said, "Well, we haven't heard from him in a while." And the brother texted, and they said, we have to laugh when we can, and it's true. And she was right. We haven't heard from him in a while.
No, but so it's like, that's a moment of meaningful connection that it's funny. We can all laugh. There's moments, it's just learning to appreciate small moments. Again, it's going back to being present in the present. And I think the more we realize that if we all live long enough, we'll all get dementia, because basically it's just a shrinkage of the brain, just like the rest of our body shrinks, so does our brain. And so if something else doesn't get us first, right,
Yep.
which generally happens. And again, I don't want to minimize it that, oh, just go, live for the moment and don't worry about it and laugh. No, it's painful. But enjoy those moments of connection. Learn to laugh at things that are funny. Not everything's a tragedy.
My final question is the final question I ask everybody, because I think that what we are trying to do here is also improve and also make positive change for people in this role. And I'm so excited to ask you specifically this question. What can we better do to support caregivers?
So this is a very important question, because to me, the most important thing we could do is support their mental health. I mean, there's many important things. That by saying this, I don't mean to say that finances should be better and a whole bunch of other things, but we minimize the effect on people's mental health. And so we think that if we just give them resources, they'll be fine. I really think we need to understand that the stress of being a family caregiver for some people is enough to affect their mood. Not the whole 20 years or 5 years or whatever many years, but at periods, at times. And it's really important that people pay attention to that. And we do not have enough supports. So understanding that it's okay to get help. It's okay to be vulnerable. It's okay to say, I'm feeling really down and I don't think I can do this on my own much longer. And when I talk about mental health supports, again, I don't also mean just if you have depression, but an opportunity to explore your feelings and to be okay with it. That if you have feelings that feel scary to us or feel like I'm not a nice person, because I'm thinking I wish they were dead.
Or I'm a bad partner, child, I'm a bad friend, I'm a bad, like associating that with badness in yourself is so detrimental.
So not helpful.
Yeah.
So not helpful. So that's the one thing that it's, if you can accept help, if we had enough supports, as an opportunity to explore some of how you're feeling, how it's impacting you, and that you matter. It's not just because you matter, because without you, the person, it won't have support. It's because you, and in your own right, need support and you matter.
Those are very, very important things. I knew I was going to be enthralled with your answer to that question that I've asked so many people now. Dr. Adriana Shnall, thank you so much. The work that you and your colleagues are doing at the Koschitzky Centre are really, really making a difference in people's lives and how we're going to move forward as a society. If people wanted to access those resources, maybe they don't live in the Toronto area, maybe getting to you is very difficult. Are there ways for them to access these resources, Dr. Shnall?
Absolutely. You can go to the baycrest.org website under caregiving, and we've developed a tool called CCART, the Canadian Caregiver Assessment and Resource Tool. You can download it as an app or find it on the website. It asks you a series of 15 questions, no matter where you live in Canada, no matter what type of caregiver you are. You answer those questions and it'll take you to mental health supports, financial resources, and not just of people with dementia, but also other kinds of caregiving relationships as well. It's a wealth of information, so you can always reach me through there. And it's been a pleasure. Thank you.
Dr. Shnall, I have no doubt that we will speak more in the future. This has been so enlightening. And I think we covered about 4 other things that we need to do individual episodes on. Thanks for listening to this episode of The Heart of It All, presented by Capital Direct. Thanks so much to Dr. Shnall. The work they do at Baycrest and the Koschitzky Centre is world-renowned. We are so thankful for their support of this podcast, and we know we'll have more doctors from Baycrest here on the pod. Make sure you are subscribed and following us wherever you are listening so you don't miss an episode. And please let us know what other topics you'd like us to cover here on The Heart of It All. Drop us a DM on any social media channel and send us an email through our website, theheartofitall.ca. Rate, review, and please share. I love hearing the impact this pod is having on caregivers all over the world. Thanks to 6 of 1 Digital, my co-producers, Jess and Carrie, and thank you for listening. I'm Teri Hart, creator, executive producer, and host of The Heart of It All. As always, please take care. This week's movie recommendation is 2-time Oscar winner The Father, starring superstar Anthony Hopkins and Olivia Colman. Both give really devastating performances as dad and daughter, and it will break your heart and put you at the center of this very complicated disease through its fractured timeline and contradictions. The Father will increase your empathy in a way that I believe only movies can do.